Thank you guys for being here. My heartbeat is just to see my community thrive. And I was born and raised in the Tri-Cities, so I love my people, I love my community. And so you're going to hear from me and Victoria and Dr. Stranker, and just trying to cast a vision for how our area can have health and how it really takes the whole community to be the solution, or I call it being the cure. That's what it's going to take. It's not going to be all the docs. It's not going to be all the hospitals. That's not what it's going to be. It's going to be the whole community. And like I said, I really love where we live. I feel like we live in the Shire. That's what I always say, like in Lord of the Rings. I'm like, the hills, beautiful, peaceful, quiet, rivers, mountains. You know, it's just beautiful. And you'll notice some pens and papers on your desk, on your tables. My hope is, as we're going tonight, very genuinely, that you would think about, you know, how am I, Adam, or how am I, Vicky, or John, or whoever, how am I going to contribute to this health movement personally, like my own health, and my community and my people around me? Because if you do that, if everybody in here does that, we're going to be successful. I have zero doubt that we'll be successful. And just like starting big picture, and then we're going to drill down into Tennessee. You know, we pay the most, and we have some of the worst health outcomes. This is not news to anybody, right? So that's sad, right? It's just a reality that of all the industrialized nations, we're at the bottom. And it's been going that way for about 60 or 70 years. So that's not a new thing, right? But if all you guys remember, like 70s, 80s, 90s, early, you know, people did not look and be as sick as they are now. We didn't have all the autoimmune disease. We didn't have all the cancer. We didn't have all the obesity, all the diabetes, all these things we did not have, right? And so our genetics are not the problem. You know, our genes didn't change as a society in 4 decades. And so then the question is like, what the heck is going on, right? And then we know that if you look at the kind of the Bible Belt, the whole Appalachian region, we struggle the most nationwide in chronic disease and health issues, drug abuse, things like that. And as we narrow down even more into Tennessee, do you guys know, some of y'all do, but do you know where we ranked health-wise out of 50?
47.
Oh, I wish 46. 48. Yeah, it fluctuates. Either if we move, that's awesome.
Yes.
But so anywhere between 45 and 48, which is not like the bottom of the barrel. So to me, as an optimist, I'm like, well, good. There's only one way to go up. And so, but it also means we have a lot of work to do. And so again, that was from Forbes. You know, we were ranked 48th out of 50. And they looked at all these categories: smoking, weight, drug use, alcohol use. So it wasn't just like one metric, right? We were 48th combined in that whole collective. And so where the rubber really meets the road, though, that's like big picture. But now you whittle it down and you have like little Cameron in front of you. You have like a person, right? Now it like really drives it home. And so 40% of our kids now have a chronic disease. 40%. Autoimmune, intellectual, obesity, you name it. Cancers are going up. I'll show you in a minute. You know, back in the 70s, I think like 10% of our country was overweight. Now it's like 60%, right? So we have a lot of work to do there. Autoimmune has skyrocketed. We have anywhere between 50 and 80 million Americans with autoimmune. Most of them are multiple conditions. So it's not just one thing. We have dementia. Any of you guys know a loved one with dementia? It's awful. It's horrible. And you watch them slowly decline. They forget your name and you love them and they don't even know who you are. And then, like I said, cancer. And the reality is, and this may shock some of you when I say it, but none of these things are really diseases. These are consequences. These are things that happen when we have things in our body, chemicals, foods, stress, lack of sleep, and this is how the body responds. So I've seen all of these types of patients completely resolve. And I call it reverse. You can call it remission, whatever. But I've seen the body's potential to heal itself. It's lovely. But we have to put it into that good environment so that it can heal. But as you see, just a few graphs, I like to go through these quickly. Cancer rates in our country are skyrocketing. Cancer rates here, but you can see too, in like heart disease, we've really not moved the needle. In 60 years, back to 1950, 70 years, we're right where we were. And it's because we're not addressing the root cause. But we're using medications and surgeries and all those things, and those can help. There's a place for those, right? If you have a heart attack, go to the hospital. or we can try to prevent that heart attack, right? And then lastly, dementia. And so, just showing you, this is just 3 diseases. I could have put up like 100 diseases. What do you guys think is causing all this? Just throw out some answers. Food. Jamal said food, chemicals. What else?
Lack of access to education about healthy habits.
Yeah, I would agree. And I would also add to that, lack of education at how powerful the body is. Yeah. Anything else?
Stress.
Stress is a biggie. We're going to hit them real quick in a minute. Good. So you guys are hitting on the right drumbeat. And so stress is one, right? Who in the heck doesn't have stress in their life? We all respond to it differently. But stress shuts down every other pathway you have hormone-wise because your body cares more about survival than reproduction. So when you're stressed, a woman can't get pregnant. When you're stressed, we gain weight. When you're stressed, you get your blood sugars worse, right? We have debt, which is a form of stress, right? And guess what the number 1 cause of bankruptcy is? Thank you. Medical care. Yes. Sedentary lifestyle. Now, you don't even have to be a couch potato here, though, because even if you're active, we sit all day long at work. And so I tell people all the time, sitting's the new smoking, right? Because when you sit too long, your blood vessels lose that ability to vasoconstrict and dilate. So you lose that elasticity. They get stiff. Pipes don't work well when they're stiff. So we're sitting too much. We're not moving enough. Obviously, the food is a massive component, obviously. And we could have a whole talk just on that. I was going to give y'all a little teaser. But do y'all know how much sugar Americans eat? 130 pounds. You wish. When you add bread and other things to this, it's 260 pounds, right? So when you look at that, it's like, what does a country look like that eats 260 pounds of sugar? It looks like us. We're just sick. We're not feeling well. All these conditions come out of that, right? And then you get into the ingredients. Like even when we try to be healthy and I try to feed my kids good, stuff sneaks in all the time. Like some of these chemicals you would never, ever put in your body. And this is just a Lunchable, right? You're trying to do the right thing. And patients are always like, I'm doing my best. And I try to support them. I'm like, yeah, you are. Rock on. You're doing great. But what do they tell themselves on the inside? I'm a failure. I'm messing up. I'm causing this, right? It's all my fault, that kind of thing. The oils we're cooking with, the chemicals we're spraying on our food, the chemicals in our clothing. We could spend a lot of time talking about chemical toxicities. And these are very hard to avoid no matter how hard you try. Insulin resistance is at the core of a lot of our issues. People think diabetes, but diabetes starts way early, right? So way before you get the diagnosis in the office, it's already started. And this is now like 70% of our country. And so you can see, though, how all these diseases arise from one common root. So when I treat 20 different patients one similar way, all these things can get better. Right? It's not magic. It's just the body healing itself. And then lastly is loneliness. This is such a huge, I'd say pandemic, but epidemic. I think the last stat I read, unless you've heard of one recently, is that half of Americans say, I trust one person or less in my life. And that makes you want to cry. You don't have someone you can go to and fully trust, right? And so when that's the case, we're overeating, we're stressed, we're not sleeping, and we're lonely. Of course we're sick. And no pharmaceutical is going to fix that. No shot's going to fix that. No hospital's going to fix that. We have a lot of work to do as a community, right? And so I never, ever blame patients for their medical issues because they really are like a fish swimming in a dirty tank. And we have no idea what makes us sick. That fish never knows that water's poisoned. The fish is just swimming. That's all the fish does. But whenever we have all these things in our food and we're stressed and we're lonely and we're stressed out on social media and we're going to bed at midnight, we don't even know why we're sick, even though the reason is pretty obvious. And so where the rubber meets the road, though, is a lot of that seems very stressful. How many of y'all, after hearing all those things, in your mind, you're like, we're never going to fix it? How many of y'all say that in your mind? Be honest. Thank you. I love you two honest people. We all say it, to be honest, because, what do you think, Joe? Why won't we fix this?
$1 billion companies fighting us.
Sure. So obstacles. Yeah, trillions. What do you think, Todd? Why won't we fix this? That's true. Yep, people won't change. Definitely heard that one a few times. Yes, ma'am.
I think sometimes we think it's too big of a problem.
You're exactly right. So why even bother? Totally. But until we start confessing or telling the truth like you just did, we will never fix it. But as we start learning how to tell the truth with each other, now all of a sudden, instead of the world being all chaotic and freaking out and we're never going to fix this problem, we're all going to die young. That's what people think. We can become what Margaret Wheatley calls islands of sanity. We can be communities of people who really want to heal in their community. And they say no to all those raging tides a second ago. And they say, we are going to do things different. That's what we need to be. Islands of sanity. I really like her term. But the problem with that is that the way we see the world will never allow that island of sanity. And I've spoken about this before. I've learned this from a friend, but I see it every day in the clinic, and I know that is true. And so, Todd, the main reason we will not fix this problem is as soon as we start thinking about it, we immediately start thinking scarcity and separation. People won't change. It costs too much money. I got billion-dollar companies fighting me. There's no hope. Bam, problem will never get fixed. And so there's these two worldviews that I want to walk you through, and you tell me if you think they're true. So the one on the left is the separation worldview that most of us live in every second of every day. And here's how the flow of it goes. So number one, there is never enough. There's not enough money, not enough people, not enough time, not enough attorneys, not enough doctors, not enough blank, right? And ultimately that boils down to, I am never enough. I had that talk a few times today with patients. That's their big issue. They don't think they're enough. So if that's true, what do you have to do? You better be real certain that you get enough. You work hard, work out harder, make enough money, save enough money, so that you know you have enough, right? The only problem with that is, in order to be certain you have enough, you got to shoot for perfection. How many of us do that? How do you get to med school? You better make straight freaking A's, have a 4.0, get a good GPA, get a good MCAT, good letters of rec, blah, 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 or you can't get in. And so in order to be perfect, guess what we have to do? You got to self-focus. Because if I get mine, if Adam gets his, I won't get mine. So I better make sure Adam doesn't get his, and I get mine. That's what happens. And it's the way it's like my glasses are dirty, and you don't even know you're looking through them dirty. That's how this worldview is. So let me show you another paradigm we could live in that I think is true, we just don't live in it. It starts with abundance, right? I've come to give you life abundantly. So there's more than enough money, more than enough people, more than enough time, more than enough land, more than enough good food. We can do all this, right? And so because we live in that freedom of abundance, I don't have to be certain anymore. I don't even know how this talk will go tonight. I don't know. I prayed over it, right? But I can just enjoy the mystery of tonight. I get to meet some new people, we'll share a vision, have some ideas, have some food, and we'll see where it goes. And so because I can just now enjoy the mystery, I could care less if I do a perfect presentation. We don't have to be perfect anymore. We don't have to have all the answers. We don't have to have some magical solution. And so because we can be fearless and enjoy the mystery, now we get to be focused on others. Because there's more than enough for me, there's more than enough for Adam, more than enough for Rebecca. There's more than enough. But this worldview is super hard to live in because it requires you to sacrifice for the other. So it's against our nature. And so if I summarize, why are we sick? This is what I would say. And all of you guys just said this. We're lonely, we're not moving, we're stressed, we're not sleeping, we're not eating, and we're being doused with chemicals. The Make America Healthy Again assessment, they just came out last week, said the exact same thing. Why are our children sick? Their food is poor. They're exposed to a ton of chemicals. They're not moving. They're stressed. And we over-medicalize them totally. How many kids are on ADHD meds, right? Like 10% or something, right? I think 20% of our country is on antidepressants, right? So that's 20% of this room. We're on antidepressants. And so what are some things we're doing And then I'm going to throw out some strategies to you guys, and I'm going to get some feedback from you guys before Vicki and Jim speak. So Vicki and I and Jim and some others, we put on a big summit last January talking about this exact thing in Pigeon Forge. It was fantastic. On our Facebook, I'll give you the link for it. We're launching some of those videos right now, casting that vision of what could Tennessee look like. And we had farmers, we had the head doc for the state of Tennessee, we had teachers, we had moms, we had dads. It was beautiful. It's a great coming together, and we hope to do that every year. And then quarterly, I host about 60 to 100 medical professionals where we're just being in community, having dinner, having speakers just like this, right downstairs. We have to start engaging our clubs, our groups of people, right? That community is such a big part of healing. So we have biking groups, we have walking groups, I play pickleball all weekend, pickleball groups. We have reading clubs. We got to start promoting clubs so people do not feel so isolated. And I think we do a decent job of that as a community. I just don't know if we like really push it and promote it as well as we could. What do you guys think? Like, do we do a good job doing this? How can we do this better?
I think that there are efforts out there. Sometimes accessibility becomes an issue. I think that there are some folks that are apprehensive to be maybe outside of their comfort zone. And so really feeling welcomed and affirmed means so much. And a little bit can go a long way. And so I think that there's a lot out there, but I do believe there's a lot more engagement that we could do.
Yeah, I think so. And it's a lot harder. Like if you send me an email, Adam, you're like, come to the Langston Center. I'm like, God, I'm busy. If you call me and ask me, I'm probably going to come because it's that personal part. So, so each of us in this room being more engaged and being in clubs, right? And here's a really fun study out of the UK. And this town is so smart. They hired 100 lay people, right? This is in From. It's spelled a little unique, but it's From. And they said, your only job is to go into the community and find lonely people and invite them into communities. How novel. So you're at the grocery store checking out. Oh, hey, Betty, do you go to church? Or are you in a bowling league? Or do you play bridge? Whatever, right? And when they did that, their hospital admissions went down 25%. Their depression rates fell, and their community in general saved $20 million in health costs just from welcoming people into community, right? This is not rocket surgery. We don't have to make it too complicated. One thing that I do to help community is I do group visits. I do that every Thursday. And so what it does is it takes this normal medical style that's common, and it puts it like this. And we cry together, we pray together, we laugh together, we do yoga together. Medicare or insurance pays for it. It's awesome. So what if we get 100 doctors in Johnson City doing that? That isn't hard, right? They just have to get over the fear of doing their first one, and then it's pretty easy. Here's one of my groups. That's what it looks like. Simple, fun, and the patients do fantastic. They do great. Reversing diabetes, losing weight, getting off medications. We see it all the time. It's not a big deal anymore. Someone's like, oh, they're off their metformin. I'm like, I know. They're off insulin. I know. Because they do it in community, right? And so churches, you have got to get your churches involved if we're going to be successful. We have like 1 million churches in Johnson City. Yet, what do? We all self-protect and self-promote. They do their thing on their side. I do my thing over here. I do my homeless ministry. They do their ministry. Why do we act like that? Let's get out there and connect with one another. So what do you guys think churches could do differently? How can we be engaging our communities from the church level? What do y'all think?
I like it when we see community health partners who are employed at churches that help members of the congregation connect with healthcare and also other things that might be driving their healthcare outcomes.
Sure.
There's not a lot of churches in this area that do it. You see it more in Nashville.
Yeah, that's true. Maybe more organization. What else? What can churches be doing? Think simple.
Find a common focus.
Yeah.
Common goal.
Yeah, stop separating. Yeah.
That all churches have in common.
Correct. It's not hard. We just need some people to drive that, right? And again, you're going to notice there's 7 categories. Think about like, where can I fit in this? Where's my people? Is it in the schools? Is it at churches? Is it at politics? Whatever. This was what they did at Saddleback Church in California. The whole church went through group visits. They had a bunch of small groups. So all the small groups went through a book, right? They lost 50,000 pounds in 1 year. 50,000 pounds. 0 doctors involved. That's health. That's fantastic. So again, it isn't hard. What about our farmers? I love my farmers. I have a slide up here from a farmer here in a minute you'll love. What do we do to help our farmers? Joe, you're a farmer. What do you think?
Buy diesel fuel.
Yeah. Buy from them? Yeah. Buy from them. Get to know their names. You got to know who they are. Ask them what they need. I hung out with several farmers last week. They're lovely. Salt of the earth people, and they have their own struggles. They're caught in this web of I got to buy fertilizer and chemicals and all this, and then they have to go to market, and there's competition at market. People don't even go to the farmer's market. I love the farmer's market. We're there every Saturday. So what if we push more people into the farmer's market, right? So here's our Johnson City one. What if, and I don't know if the schools do this or not, but what if the schools start buying food from our farmers? It isn't that hard, right? One of my guys, Matt, he's a farmer today, and I said, hey, what do y'all need? He said, I just need people to buy our food. He said, I threw away 2 tractor trailer loads of food last year. I said, why in the world did you do that? He said, I couldn't sell it. I started giving it away. I couldn't even give it all away. I'm like, that makes no dang sense. Right? When our kids are eating crap in school and they're stressed and we have homeless people walking everywhere, and we're throwing away 2 tractor trailers full of food, that's ridiculous. But Matt didn't have any other option. It's not Matt's fault. We got to support our farmers, right? And part of that's just getting to know them. But part of it is making them know they're welcomed and we care about them. And so we're hoping to do some more farming events. Maybe, Joe, you can lead that. Yeah, you got it, dude. Our school systems. Are our school systems a healthy place? Are we serving good food? Do we have physical activity every day? I love there's this nationwide movement to back up school start times. That would be amazing. Inconvenient for parents, sure. But I wake my kids up at 6 for school. It's freaking mean. They're so exhausted. They're so tired. Why do we do that? It's purely out of convenience for parents. So we can drop them off at 7:40 and get to work at 8. How about we just change all of that and let the kids sleep in a little bit? It's common sense, but we're just afraid to do it, right? But that's picking.
We aren't in charge
Correct.
of those rules
Nope.
tied to the school.
Yeah. So we talk to our friends. We talk to Tim. We talk to Rebecca. We talk to others. We start having those conversations. But you're not powerless. Like Tim and them love our people. They'll go to bat for us if that's what the people want to do. You know. What about our businesses? Right? I just threw up some local businesses. You know, what are they doing for our health? How are you like loving your team members, your staff members? What do y'all think? Vicki, you run a company. What are you doing for your people? Or what could you do?
Yeah, my staff is incredible. They operate in such a spirit of excellence. You can tell by the food that they put out. They go above and beyond for everything. And, we had a massage therapist at work today who
Nice.
spent 15 minutes with the employees. So they took their 15-minute break and went in and got a massage so we just do things like that to try to thank them for, they're volunteering tonight, by the way,
Yeah.
for their spirit of excellence.
Yeah. Because you love them well and they're here volunteering on their time off. That's perfect. And we could go around and we could pick different businesses. There's a lot of business owners here. How are you loving people in your business and like pushing them towards health? Just a question, something to think about. In medicine, how are we running our clinics? How are we running our hospitals, right? If I go into the hospital, am I more likely to get a Coke or a water? I don't know. Probably a Coke. I mean, like that's just it's our culture. But you have to start changing the culture, right? Whenever they leave, are they talking to dietitians and nutritionists and getting like good advice? Do they feel supported? Are they connected out in the community? If any of you really want to be healthy, do you think of, I should go to the hospital? None of y'all. We should flip that. We could flip that on its head entirely. It just takes some effort. So if you think about health, where do you want to go? People think about Mayo Clinic, Cleveland Clinic, Kaiser Permanente. You think about all these other places. They've already done this. We don't have to reinvent the wheel, right? And so what Cleveland Clinic did, just as a quick example, they found, you know what? 80% of our costs are from chronic disease. Okay, that's fair. And most of that chronic disease is related to those 6 things: blood pressure, weight, smoking, cholesterol, stress reduction, and normal blood sugar. Not hard things. So they said, how can we incentivize our staff to do this? So they just said, hey, if you participate in this, we will reduce your overhead or your deductible by like the maximum amount. And what they found was absolutely incredible. They started off with only 6% of their people meeting those things, which is pretty bad for healthcare in general. 3% of the country meets that, by the way. So they're twice as good as normal Americans, but 6% had all 6 of those. That's it. At the end of 10 years, though, what was it? 42% met those requirements. Isn't that amazing? It's awesome. The staff individually saved $1,400 because Cleveland Clinic paid for it. So now your people are saving money. Smoking went down to almost 0, 5%. Weight goes down, 70% participation with 0 force, like you don't have to participate. 70% chose to, right? Hospitals admissions went down and their healthcare costs were stagnant. And if I put the slide in here, I didn't put it. They have Mike Roizen, who's the doc who started that. He's written several books. He's a great author. He told me when he started this, they almost killed him because he told Toby Cosgrove, who was the CEO, he said, Toby, I'll do this, but you have to protect me. And Toby said, what do you mean protect you? He said, they'll try to fight, like they'll try to fire me. And they did for 2 years because it cost money to start it. At the 3rd year, they saved $20 million. The 4th year, $60 million. And now they're best buddies with Mike now, right? After 10 years, $1.2 billion they've saved. This isn't hard. Like, God, it's not freaking hard. We just have to be a little fearless and brave and try new things. So in medical education, before I go to that, are we teaching nutrition in school? And the answer is about this much. It's not 0, but it's pretty freaking close because I went through medical school. And I'm an osteopath, which is more holistic, and we barely had nutrition. But it's not required. Do you know who makes it not required? The American Medical Association. Because who pays them? Go look at their sponsors online, you'll see it. So we have to start changing how do we educate our doctors, our nurses, our PAs, our NPs. Because right now we're focused on pathophysiology, pharmaceutical. Pathophysiology, pharmaceutical. We're not focused on health. It's a difference. And then in healthy tendency politics. All right, so how's our politics, folks? How are we driving health in our state? Right? Because that is kind of what Rebecca said. That's where the rubber meets the road from laws and things. So Tim, we require you guys. We need you guys. We can't do it alone. And so how does healthy tendency politics come in? And then just a far off dream I've had for about 12 years. Have any of you guys ever heard of longevity centers, lifestyle centers, all that? So we have some beautiful centers around the world where people will go and learn how to have health, and they'll do all these natural therapies, all these things. It's really awesome. But they're $10,000 a week. So how can we have one of these in Johnson City or Piney Flats or Jonesboro, wherever, that people can afford? Right? So the guy blowing leaves outside can go here for a few days and learn what's it mean to have health. That sounds amazing to me. And this will happen. It's just a matter of time. And so we're casting all this vision because I want you to see, where do I fit into that puzzle? Because we all have different giftings and we all do different things. So I cannot do things Dave can do, and Joe can do things that I cannot do. And if we lose Dave from health, the entire community suffers. If we lose Karen from the community, the entire community suffers. So, and that's partly why I'm so passionate, is when people are sick, guess what? It knocks them down. They can't do nothing. It's not that they can't do anything, but they're limited, they're restricted. And that's what makes me just cry. I didn't cry when my kids were born, but I cry when I see an amputee walking. My wife always makes fun of me for that. But when I see somebody restricted who can't live up to their potential, it breaks my heart. And so that's where the rubber meets the road for me. And so Vicky's going to come and share, and then Jim's going to share. But what I want to, but at the end of tonight, kind of the deliverable or the ask is number one, we'll start meeting more regularly. But number two, how can we start moving this ball more and more and more? Because grassroots wise across the US, this is busting right now. Make America Healthy Again, Moms for Health, a bazillion things are happening. For the first time I've ever seen in my life, they're actually talking about health, getting the chemicals out of our food. That's amazing. Simple, but they're actually doing it. Getting movement in school, pushing back our start times, all that stuff. We need to capitalize on the momentum. So that's just my feeling. And so, and I'm glad y'all are writing already. Be writing down thoughts on your papers, because you can hand them in or you can send them to me later. But you guys have a lot of thoughts that I don't have. And so that's where this community piece comes in. So before Ms. Vicky comes up, are there any thoughts? Like what are some burning thoughts on y'all's mind of how we could help our community thrive?
I think what would be helpful, and I have no clue how this would work, but like there are fundamental things kids are not taught in school.
Sure.
I teach a personality class where you learn not only how to self-awareness, but then how to get along with people who are different than you. Why is something like that not taught? Because it's so necessary.
Yeah.
But who would you talk to? Who would you try to get that kind of thing implemented? So it's like, how do you even know who to ask, I guess?
Probably the school boards. And Ginger was here a second ago. She had to leave. So that's where the school boards come in. And a vision I had, because if you're going to attain a goal, you got to be strategic, right? Let's get healthy. That's a beautiful dream, but that's way over there somewhere. So you have to turn that dream into a goal. And so in order to have goals, you got to have strategies. And so one of my thoughts is, let's have a Healthy Tennessee Farms division. Healthy Tennessee politics, Healthy Tennessee schools, Healthy Tennessee medicine, Healthy Tennessee whatever, right? That's probably how we're going to be specific in all the SMART goals, right? So good. What else? Because I know y'all got thoughts. You're just afraid to speak up and say it. Or tired, one or the other. What do y'all think? Tom, what do you think? You have beautiful ideas.
You know, I think that we need to figure out a way to share those pockets that are going on, because we heard about a small business that we heard lots of things for their employees. We have lots of things for our employees. So we need to figure out how you can share those.
Mm-hmm.
You know, celebrating successes and understand where it didn't work and why it didn't.
Yeah.
You know, you talk about sugary drinks in the hospital. We had Mike Boyce in here.
Yeah.
Several years ago, and we removed all the sugary drinks for patient trays. We would have thought that Armageddon was going to happen.
And you have to survive Armageddon.
So it's more contamination, you know. So one of the things is just those connections of what's working, what's not working.
Yeah. And not separating from one another. So like, oh, they're ballad and we're sofa. Who freaking cares? We're neighbors. You got to get over that. And so I agree. Communicating successes, celebrating wins. Let's do one more. What else? Yes, Jamal.
So we know what's healthy and we know what's good for our patients and our children. But there's a lot of people in the society and the community who doesn't understand what we're talking about.
Mm-hmm.
So how about we make one day, like a day, like we do 5K, we do turkey trot for the city. How about we do one day Tennessee Healthy?
Mm-hmm.
And few people talk, explain to the population and the city, what is it about to be healthy? How can we improve? Like what we're talking now,
Mm-hmm.
a little bit, different. We pick multiple people to give talks.
Mm-hmm.
Let's say 1,000 of people that are listening, and this is how we can start educating people. Because if I'm gonna do it on my own, and you do it on your own, and he's gonna do it on his own, we get small population.
Mm-hmm.
But if we make a big day, like Girls on the Run or Turkey Trot,
Mm-hmm.
you have 5,000 people there.
Yep.
And you can, at the end of the race or at the end of the run or the walk or whatever, we can talk to them before and after. This is why we're doing it. This is our goal, how to get you healthy. Things like that, spiritually, mentally, medically, all the way. So
Mhm.
we would have spiritual speaker, not religious, because spiritual speaker, medical, nursing, school, anything that can help.
Yeah, I'm glad you said that because I had two thoughts. One is, and I'd forgotten, so thanks for reminding me. One is, what if we start hosting like monthly talks that the public can just come to, right?
Podcast.
Well, you can podcast them as well, but I mean, like things people are really interested. How do I get off my meds for diabetes? How do I help my body heal to where I don't need medicines anymore? That's a fun topic. Yes, sir, Jim?
Not only that, but testimonies from people who have.
Oh, absolutely.
Role models, communication.
Absolutely.
That's really a huge opportunity.
Oh, it's huge. And we could just do that monthly, like TEDx style. You know, and have people, whoever wants to come in the community, come. But there's also a healthy county movement where all these counties are having these big get-togethers, and they're trying to have 1,000 county health day, October 18th. I think that's the day. Maybe we just have one then too and join them. So good.
I think too, sharing the different health fair events, like there's a big wholeness expo this Saturday.
Oh, how do you know about that?
See?
Yeah.
And it's an incredible opportunity where it's the whole body approach, and there's people there about finance, there's people there about
See, where are they at? Where's that at?
it's going to be at the Memorial Center
Okay.
Saturday.
All right, I'm there.
10 to 3, it's free.
All right. I expect to see some of you guys there.
The other thing I think we have to do is we have to understand the segments of our community.
Yeah.
Because there are those who will understand, yes, they think they can get healthier.
Yeah.
If there's that myth out there, whether I have no access, I can't afford it, it won't happen, don't change my diet, I'm used to this. We gotta figure out how to create that already platform
Yeah.
and incent people to be there, because we're gonna have the same people who come to all our health fairs.
Yeah.
How do we reach the rest of the masses?
Yeah, and a lot of that's going to be individual. A lot of it's going to be health, like gatherings. Like you hit the runners, you hit the pickleball people, you hit the bikers, you hit all these different groups of people. But it just requires all of us to get in our own communities and do that. But yeah, you're right though, Tom. People, my mama had diabetes, my grandma had diabetes. I'm going to have diabetes. I'm like, wrong, false. Like fact, false. That doesn't mean you have to have it. Yes, ma'am.
But I also think that, right, wrong, and different, we become a culture of convenience.
Totally.
And I think that so many people, they want, right, we want to get healthy, we want to be able to do this. We want to be able to live in that second world view that you post, but we've also created this lifestyle that, like, it's not that easy just to stop, right?
Nope.
So, and we get going really well, but it's like, it's not convenient. When you have to go to 5 different grocery stores to find anything remotely healthy, you've got to seek out all this, and it's like, we can educate, but if we don't start making it to where that, especially that population we're trying to hit, where it truly is an easy route.
Mm-hmm.
And we know being healthy should be an effort, but reality is, if it's not easy, people are just not going to do it.
Sure.
And so how do we make that where it is a little more convenient with true tangible action items that anybody can do, and it's not like you're out reading 50 different resources, meeting with all these people to try to find one decision that's right.
Yeah. Well, and I was talking to an old farmer before I invite Vicky up. And then I have one more thing to show too. I was talking to an 84-year-old farmer the other day. So funny. And I said, hey, what do you need? I'm talking Monday night. What would farmers need how can we support farmers? And he kind of sit there and thought for a second. And he said, if you're going to be successful, you got to have 3 things. So I'm like, turn on my listening hat. I'm like, all right, old farmer wisdom. He said, you got to have desire. He said the 3 Ds. I'll make it easy for you. You got to have desire. So some people, Steph, do not have desire. They're like, no, my mama had it. I'm going to have it. Desire's gone. So you have to replace that desire and make it there, right? Everyone in this room has desire. You wouldn't be here. You all had a busy Monday, so thanks for being here. Desire. Then you need dedication. So you have to really get after it, not just on one Monday afternoon, but for months and months and months. And then you have to have discipline. That's what he said. Desire, discipline, dedication. I said, I'm going to write that down. So the desire is here, no problem. The dedication and the discipline is hard. So how do we cut sodas and survive Armageddon? Holding hands. You just buckle down and do it. How do you remember when y'all cut smoking out of the hospital? I bet they raised hell about that too. I guarantee it. But it's okay. We start shifting the culture, right? It's painful, but it's okay. A little pain's all right. A little pain never hurt anybody. Then the other thing, not too much. The other thing too is we have been partnering with the Blue Zone group out of California. If you're familiar with if all of y'all watched the Blue Zone documentary, it's lovely. It's on Netflix. It's 2 hours long. It's 4 30-minute chunks. I watched it with all my kids. They're 5, 5, and 7. They loved it. You guys would love it. And it's the idea of health doesn't have to be hard, but it does have to be intentional. And so these are the 5 places of the world where they have the most centenarians. They live past 100. And they go into communities like ours, and they help make overarching goals for the community. They work with politics. They work with the governing bodies. And they're great. And we've already had several meetings with them over the last year and a half to do a joint project in Kingsport and Bristol. And the reason those 2 cities were picked is the population size. They like to have a certain population size. So we're hoping to raise some money through our businesses, through our hospital systems, through individuals, so we can fund this project. Because when the rubber meets the road, I'm working full-time, got kids, activities, all that stuff. I only have this much time to give before my wife kills me. Vicky is working full-time. She's busy. Jim is working full-time. Jim's busy. We got to have people own it, who can do it full-time where they get paid to do it. And I could do it. If God tells me to go do that full-time, I'm there. But he hasn't told me that yet. So we need to have someone own this, and that could be the Blue Zone people, or we as Johnson City could hire 5 people to run this division and run with it. But it's going to take some equity. It's going to take some money, time, all that. But I know that we can do it. I have zero doubt. It's just a matter of how do we get there. And so I really value you guys. I think there's a lot of potential in the room, a lot of good ideas. And I hope that we can partner together to see our area thrive. And I have all your emails if you wrote them down. And then I'll put back up that QR code for the Facebook group so we can try to start being in a little bit better connection. And we need to have one big place where a wholeness activity, everybody knows about it.
To share events.
Yeah, exactly. And there are those small things that exist, but it's not all one unified thing. Maybe it's the Johnson City website. I'm not sure where we do that, but. So I'd love to introduce Vicki Blinken. Vicki is the executive director of HPI, Highlands Physicians, Inc. And she's mostly in Bristol, so I love having her in Johnson City. But Vicki's going to share some thoughts from Blue Zones and just from the health of our region.
Yeah, thank you, Michael.
Thanks, Vicki. Yeah.
Well, I hate to say this, but I'm going to make Michael a liar today because he said he'd have you all out of here on time, and I know Dr. Shrinker is very long-winded.
He does.
So, I don't think that you guys are going to be out on time, but I'll make my part really super quick. You got the clicker, Michael?
Yeah, you have slides.
I think so. I sent them to you. Did you not put them up? It's fine. It was just health statistics. So my part will be really quick because I emailed my slides to Michael and he didn't put them up. But actually, he went over a lot of the information that I was going to go over. A couple things that I want to address. I had some statistics from the Tennessee Health Department and some statistics on obesity. Michael addressed those. I also had the Sullivan County Health Assessment from 2020. He addressed a lot of those statistics. So just so you know, what he's talking about is actual obesity rates have skyrocketed. The poverty rate in Sullivan County is almost 15%. The Alice family designee, who knows what an Alice family is? Okay, we have some people that know what Alice families are. Jim, what's an Alice family?
Oh gosh, it's the working poor.
Yeah, exactly. It's your working poor. It's the people who work 40 plus hours a week and can't afford gas or groceries or have to choose between childcare and medicine or whatever. So you add that 15% poverty, below poverty level, to your Alice family designees, and you've got a serious situation of poverty in Sullivan County alone. So what I love, one of the things I love, Tom, one of the things I have watched and followed with Ballot Healthcare is your daycare centers. I have a lot of moms that work for me. We have a very relaxed policy. They can bring their children to work with them during the summer. And, you know, people say, doesn't that affect your productivity? Well, if my mom's missing work because she doesn't have anybody to watch her children, that really affects our productivity. And as I said, we have people in our office that operate, everyone in our office operates with the spirit of excellence. It's such that I have never seen, and it's such a blessing. If you all want to see a spirit of excellence, come to our office. They don't always have shoes on, but they operate in a spirit of excellence. So I love that. I followed that so closely, and I'd love to touch base with you all on that. If we had the finances, we would love to start a daycare like that for our employees, but we're very small and we don't have the finances to do that. So maybe we can tap into the ballot resource and do that. That would be such an asset for our entire community if we could all work together to do that for moms and dads who have to have their kids in the summer, and when their child's sick, they can't go to daycare. Another thing that I love, I'm the chair of Healthy Kingsport, and so we have a program at the Kingsport Farmers Market whereby you can walk a mile and get bucks, produce bucks, and you spend those at the farmers market. So we have people walking 4 or 5 miles, and that's their money for their produce for the week. So it's a great program. I don't know if Johnson City has it. That's a great program. I love that. I took my 7-year-old, almost 8-year-old grandson to the farmer's market this weekend, and we go every Saturday. And he said, "Nina, what are we buying today with our bucks, our free money?" And it's free for him because he could walk 100 miles and it wouldn't affect him at all. But he gets to spend his bucks on whatever he wants to spend it on, and then he gets to choose the menu. So it's a great bonding activity for he and I, just a great program. So the Blue Zones, what I love about the Blue Zones, Amber said, how do we make the healthy choice the easy choice? Well, the Blue Zones do make the healthy choice the easy choice. And they're proprietary over their business model, but Michael and Jim and I think we have it figured out. The healthy choice has to be the easy choice, or people won't make that choice because our lives are busy, our lives are full, and if it's not convenient, we're going to choose the convenient route. So I will turn it over to Dr. Shrinker now. I told you that I would be quick. Unusual for me, I know, but I think you guys will enjoy Dr. Shrinker's presentation as much as you did Dr. Mabry's presentation, because both of these gentlemen are exceptional speakers and exceptional members of the community. They love their patients. I am very passionate about independent physicians because I think that's the linchpin for healthcare. I think that's where relationships are formed and built. I've been with Highlands Physicians, the IPA, now for about 15 years, and we've been servicing the community of independent physicians for about 30 years now. So half of their life and half of my life has been at Highlands Physicians. So, Dr. Shrinker?
It's been like 3/4 of my life, if not 75% of my life, because I'm so young. I guess I'll use it. So, how sad is it that we're sitting here talking about how to make people healthy and not including doctors? It's a bunch of crap, right? Because conventional medicine is only going to push a pill. They're only going to do something. They're not going to address the root of the issue. So, is my thing on here? So we've been doing, I'm Dr. Shrinker. Brandy Shrinker's my lovely bride. She's the dietitian in the office. So I didn't need to go to nutrition training. I just married one. We have integrated health concepts, and we have closed the loop on healthcare when it comes to trying to reverse disease and make people better as far as what we do. But really, I think the reason we're here tonight is how can each of you and your businesses close the loop? We've addressed the problem. We don't need any more statistics. We know that they're dismal. What can we do to make meaningful change? And we can't walk out of here chewing on an elephant, right? We got to distill this down into something. So the Blue Zones bring several things to the table. They bring a national brand recognition. They got the experts to come into a community and try to help transform it, but it comes with a cost. That cost is $50,000 for them to show up for one meeting like this. That cost is $250,000 for them to go in and walk in Food City and walk in Aldi's and walk in the Wellness Center and walk in the Y and tell us what we have in our communities. I think that it would be a good thing to do that because we're not going to do it, right? But that's $300,000. And if we're going to pay them, why can't we develop our own staff? Why can't we do it? Because Amy doesn't have enough time to do it. Nobody here has enough time to do it. But if we hire the right people, could we do that? So the result of this meeting is, where do we go from here? If we want to make all this stuff count, what do we do to implement better food, more mindfulness, better community, right? What do we need to improve the health of Bristol? We don't need another damn doctor. You know, if hospitals were working, they'd be empty, right? So we don't need any more. We need clean, affordable food that is your first choice. We need somebody to stand up to some of these fast food companies and say, look, we're not giving you a zoning permit. We don't need another damn Zaxby's, right? But we do. I mean, we utilize those things because of our lifestyle. In order to change the lifestyle, you have to change your consciousness. In order to change your consciousness, you got to have that mindfulness. And you got to say, look, I'm not going to work as hard as I used to. I'm going to go home early and I'm going to food prep. I'm going to food prep for the week and I'm going to eat it. And I'm going to bring my food to work. And I'm going to eat whole food, real food, single ingredient food. And I'm going to take 15 minutes twice a day for mindfulness. And if that mindfulness is prayer, if that mindfulness is meditation, if it's yoga, it's that. If it's exercise, it's that. But if you don't do it, this ain't going to work. So you guys got to start doing this because you have the means to do it. You have the power to do it. And you have the power to change. And if we don't change, it's our own damn fault. Because we know there's a problem and nobody's going to fix it but us. So do we want to pay Blue Zones $300,000 to come in and give us a really good product and give us some buzz and give us this boost? Or do we want to develop our own staff and for $300,000 pay 2 or 3 people 3 or 4 years of a very good salary in order to do this and create? None of us want to raise funds. All of us have been in these positions where, oh yeah, this is great, but now we need $150,000 a year to meet our overhead. So that's what you guys need to help with. How do we do this? How is this sustainable? One thing that we need to do is we need to brand. If Healthy Tennessee is our brand and if that's our logo, that's our brand. Anybody here that advertise, can they put a little Healthy Tennessee at the bottom just for buzz? Nobody's going to show up. The community's not going to show up for a meeting like this, but if we can piggyback for 5 minutes on somebody else's show that people are there. Hey, look, this is what we're about. Go to our website. We're trying to make Tennessee healthy. We're trying to do this. We're trying to do that. So if all of us could do a little bit, then it's going to seem like there's a big movement going on. And not one person is going to have to shoulder this burden. But what are we going to do? What are we going to do when we leave here today? Are we going to focus on food? Are we going to focus on community? Are we going to focus on what?
I think you need to design it because I'm sorry, I'm an old thinker, but I'm not very good at doing it all myself. Coop, you're going to do 3 churches this week or whatever.
Right.
Everybody needs to sign on. Okay, I'm going to take care of this before the next meeting. Or
Right.
I'm going to do this to start it.
Right.
Where there's something tangible, yeah, like I say, chewing on an element. Oh, that's all right, it's overwhelming. But if we all were assigned or
Right.
to do what you want to do,
Right.
then you guys figure out what it is we have to do to make this network work, and we can all try to do that. Does that make sense to anybody?
We have certain categories. Yes, perfect. So we have certain categories that we need to do, such as community, such as food, such as schools and things like that. We can do that, and you guys can sign up for under those certain things and promote what you're going to do within that realm. And if we all work together, this will work. Because it's not one thing that's going to do, but none of it costs money. Everybody's got to eat. Doesn't cost any money to shut up and listen, right? It's just, we got to do it. We're so busy. And everybody here's got a million excuses not to do it, and they're all legitimate. But shit, apathy ain't got us anywhere. So, what are we going to do? What I was going to do, is that mine, yours? What is that?
Keep going. Keep going.
Mine are easy. Okay, closing the gap. Look, I just got pictures. So this is integrated health concepts. This is what we do. That's our waiting room. That's what you're looking at. So what do? We take the medical out of medical, right? So what we're doing to close the gap is to get you out of the doctor's office as much as possible. How can we reverse your disease process so you don't need to see a doctor? We sell supplements. We sell all sorts of stuff. Anything to make a buck because Blue Cross Blue Shield pays me shit, right?
Say that.
I absolutely can say that. It is a fact.
Oh my.
So there's our teaching kitchen. Do you know what insurance companies pay a dietitian to talk to somebody about the number one cause of all diseases? Nothing. They don't invite. So we got this teaching kitchen, and that's the way it looks every day. You know, we have classes, they're sold out, but insurance doesn't cover any of it. So these people are the people that are already inclined to change their health. So it's just like you said, we're just talking to the same people all the time. And it's great, and they love it, and they want to do it. I want to get people in there that don't have the means, that need the insurance to cover it. I want to get the people that we can make change. Group classes. Great. You know what? We could do a group class and we can get a 214 for 10 people. And then she could walk in and do the teaching class, but she's still not getting paid. You know? So, I mean, it's just taking this dollar and doing it over here. We got to get some changes in there. So one of the things that we did this year is we planted a garden, a lovely garden. And my lovely bride was in charge of the garden for a lot of it. Tracy planted it and watered it. But Brandy went out and picked me this lovely salad and she puts it on my desk. And I'm seeing patients and I go in for 5 minutes because I got that. And all of a sudden there's a million chiggers on my desk. And I'm eating the salad and I'm eating the chiggers because I don't care. And all of a sudden it's like, and I look down and it's like weeds and thistles and everything else. I'm like, Brandy, did you not pick the lettuce? She goes, well, I thought it was all lettuce. I'm like, no. So you know, Yule Gibbons, many parts are edible. But that's one of the reasons we planted the garden is it was supposed to be in cahoots with Tennessee High. And they planted some plants, but they didn't really do any maintenance. But the whole idea was we tell people to eat plants. We tell them what to do. Now we're planting them. Now we're harvesting. The first couple days that we brought in lunch for the staff and we're feeding the staff with this, they were still bringing in Chick-fil-A. But the last couple times they're eating it. And they're like, yeah, this is good. Thank you for that. So they can change. But that was our lunch that we provided the other day for our staff. We don't allow pharmaceutical reps in. We don't accept outside food. We're going to make what we make, and it's usually going to have plants in it. So this is the mindfulness part of it. We have yoga, we have massage, we have Reiki, we have hypnosis, we have neurofeedback with Christy. You know, we do all of that stuff there. Anything that we can do to get people out of a pill or out of a doctor's office. That's how we close the loop. How do you close the loop? How are you going to do it in what you do? Is it simply enabling the staff to eat better? Is it enabling the staff? I mean, nobody that's running a business is going to go back and say, everybody gets 2 hours off to meditate in the middle of the day. That ain't going to work. But what can you do inside your comfort zone with the people you work with to promote wellness, to promote this? And that's up to you. I don't know how you're going to do it. And that's our little Zen frog there in the whatever pose that is. So the whole point of this is, do we want to spend money with Blue Zone or do we want to keep the money here and do it ourselves? And I don't know. I don't know that I have the answer. I know that if we don't employ people full time, it isn't going to work. And I know we got a daunting task to do. But gosh, we got the Maha movement, we got the moms, we got all sorts of stuff. We got 4 or 5 different dietitian groups. The community, what is that? The Physicians for Responsible Medicine, you know, and then the Dietetic Association is starting to come in line a little bit more. So we got all this movement in there. How can we harness that and how can we bring that to Tennessee, to specifically Bristol, Kingsport, and Johnson City? That's the question. I don't want to lose your time here tonight by going, God, we didn't do anything, but we got to figure this out, and we're the ones to figure it out. So And that's a rhetorical, open-ended question. Dr. Mabry will field all of your responses and categorize them and get them back to you. So, but thank you for your time.
Any consideration develop a project manager to pull all of this together?
Right. That's the question. How?
It's like a mission, mission statement. I mean, an outline, and to break it down into eat the elephant one small bite at a time. Literally.
Right.
I mean, it's breaking each of these down into pieces so that they're manageable with objectives and so forth. I think again, an overall game plan.
And I think with our staff in our office, we might have enough resources to at least get that out, to say that, and we could work with Vicki and Mabry and try to get that outline out to where we can say, this is where we want to go, this is the position we need, and these are the goals that we have. But we need a place for everybody to go. Do we have a website?
In process.
All right, so we'll have a website. That'll be a place for people to meet. But yes, that's exactly what we need to
We
do.
need a communications plan to share that information not only with this group, with each of the target groups, the general public.
You're in charge of communications.
That sounds perfect, Jim. We have a
He
project
is
manager.
the editor of the last newspaper in the world. But no, so Mr. Maxwell will help us with that, I hope. Yeah, that would be great. And then if we can disseminate that information, then we should be one step ahead of where we are now.
Yeah, baby steps. And before I forget, please get that QR code, because that's our Healthy Tennessee Facebook page. So before you leave, do not leave without scanning it so you can just join it. I don't sell your information to anybody, I promise, but that's just one way to keep in touch with each other.
Anybody else got any concerns or questions or thoughts?
One, and Michael, I was going to send a note, it wasn't on your slide up here, but we're missing the nonprofit sector.
I would put that in the businesses.
Nope, we got Amy Mosley.
But you got Girls on the Run, we got Langston Center, we've got Project Access, we've got Second
Right.
Harvest Food Bank. I mean, we've got all these, and you're talking about that, which I think is a really practical idea. What does it look like to come in and do a 5-10 minute cameo at
Right.
different event?
Right.
Yeah.
Almost all those organizations would be open to that.
Right.
They have a facility. I mean, there's just but
I mean,
it's a little different than the business sector.
Well, when I think in my mind, I had them under like clubs and groups, but
And that is the other part of that is within the nonprofit world, in those segments, like with Girls on the Run and Langston Center, there's a natural affinity. There is a linkage of community that you can tap into, and it's, and just different people's passions and things. But we always think of that as the fabric that just lies right below this entire region. It is so connected through businesses, churches, nonprofits. They're all interlinked in some way.
they are. And you don't want to miss that.
Right, and I think so. It's something where I think when we start rolling this out, I think that I would encourage to think about that as part of the strategy, because they could add it to the program very easily.
Well, and to,
CC is doing amazing things.
well, to be honest, it won't work if we don't do that. Like if we don't include everybody and everybody feels like they have a seat at the table, it ain't gonna work. So yeah, I agree. Maybe you can help us start a 501c3. Because I mean, like this stuff, like me and Vicki paid for it. Like we had zero money because we don't have it's not an organization yet. It's just us. You're right. And you guys are now a part of it because you're in the room. And so we have to grow it. Yes. Huh? Do you want to speak? Oh, you're not interrupting, but I was just going to say, but yeah, just we're on that precipice now of, okay, let's put some legs to it. We've had a summit in Pigeon Forge. Great. We've had some events. Great. We have pockets of people who are hungry and ready to make change. Perfect. So now we just have to run with it. We're all in the car. So now we got to start the engine, put gas in it, and then we're off. And so I think probably some of our next steps are getting the website, making some kind of a 501c3 or something where we can, or partnering with one. And then having a director, praying for a communications person like Jim, having the right people come along who can make that. And then businesses can figure out, how do I be a part of that movement? Nonprofits, how am I a part of that movement? And then each of us start picking a school. Like, Jack and Cassie work over at the school in Sullivan South. I go there twice a year, teach nutrition classes. The kids are awesome. They're hungry for this. They don't want to, I don't want to be like my parents. That's what they say. They're 18 years old and they know I don't have to be like that, but I don't know what to do about it. So I'm in Sullivan South teaching. I can't be at everywhere, so we've got to have more people teaching. He's up at Tennessee High teaching. Like, we're all doing it. So, but the organizational piece, Jim, I think is where we're at. Dr. Matuk, what were you going to say?
I wanted to say that we have to educate the public what's healthy, what's not healthy.
Yeah.
Because there is still people who think Pepsi is okay, it's healthy.
I thought Diet Pepsi was okay. Exactly right. You're exactly right.
Because the diet is now people know sucralose is bad.
Correct.
Sugar is bad, so they want to drink dairy or Pepsi because this is supposed to be good.
Yes.
So people don't know what's good, what's not good. So we have to teach them, educate them, and definitely start with kids growing up. Once we change their minds, we can teach them. They have to be willing.
Yep.
Then we can make that change.
Yep.
Because we can speak all day long. If they're not willing to change it, they don't get there.
Yes. Well, and my big thing is people are like, how do we make people change? I was like, well, you've already lost that right there.
Right.
You don't make anybody do anything. You invite them. And some will turn you down, but they'll remember you invited them. So later it's like, you know what, Dr. Mabry did say something. And then they'll come back 6 months later, and now they're doing it. So there's no hook attached. Like, we just invite them because we love them, and they'll do it when they're ready. But we provide the railway to success and health and freedom. Yes, Brandy.
I think the challenge for dietitians is the fact that the patients go a lot of times to see physicians, and you're well versed in nutrition, but it's very challenging for us when they're getting a million different messages.
Mm-hmm.
And, then they come and say, well, I don't know who to even believe anymore. So I think
Mhm.
part of this would be, let's all get on the same page and talk the same language.
And at least have,
I'm gonna do this because my doctor told me to do that.
and not get too much in the weeds, but have a lot of commonality. Yeah. But, oh yes.
I was gonna say, what if by the end of the week, Friday, everybody here messages the Facebook page with something that you can bring to the table that you think would be a good idea that you could be responsible to help with? That way, when we go back and sit down and try to organize all this, we've got all those ideas and those people that could be that key person to help with that. So we have something to kind of work with. Because we're going in blindly too. That would help give us some information to kind of go off of who's got what connections, who could do this at what church, or who's got this ability to talk to these people. Let us know those things. So send
Yeah.
that to the Facebook page by the end of Friday, and then we'll sit down next week and we'll try
Yeah.
to organize
And-
it and make a plan.
Well, we can get the nonprofit and all that stuff up running pretty quick. Just timing. And then having the people to run it. But, oh yes, ma'am.
I
And
was gonna say, one of the other things, I think in concert with what she was saying, is that we also want to know what other entities are doing.
correct.
What we're doing on the task force at Langston.
Exactly right.
We're concentrating on the 601 census tract.
Mhm.
We know what's there, trying to assess and see what the community wants.
Mm-hmm.
But one of the things, I've been doing this for a long time. One of the things in some of the projects that I work with ETSU is that perception is everything. And I know from a doctor's perspective, as you just said, we just need to tell people what to do, and they'll just go, they need to know what's healthy, and we've been doing this for a long time. I started our health ministry team in our churches
Mm.
back when Betty Goa was alive, and her idea was that she said, we want to have a health ministry in every church, but it's one thing to have that desire, but as you say, it's going to take dedication and discipline. But we also have to recognize that it's going to take small efforts in small pockets,
Yes.
different people. People are, in a lot of cases, resistant
Mm-hmm.
to folks coming in and telling them what they wanted.
Sure.
I appreciate my doctor, who's a state of Franklin doctor, who always allows me to, when I go in, he said, "Hey, Margaret, your numbers are this, and this, and
Mhm.
this," and I always say, "Okay, What can I do without medication?
Yes, ma'am.
And he is the kind of doctor that says, okay, we can do this, this, and this. And let's try this, and this. But every doctor isn't singing that song.
Sure.
And so people get frustrated, as you said. You have a dietitian who tells you one thing, a doctor who says, well, you can change your diet all you want, but you need to go on this medication. So there has to be a concerted effort. And then the other thing, like I said, we need to make sure that we know what everybody else in the room is doing.
Yes, ma'am.
So, and I don't suggest sending it to the Facebook page, but sending it to you.
Mhm.
I'm sure you're gonna follow up with an email.
You got it.
And so we can tell you what we're doing with Langston
Mhm.
and those efforts and see how we can partner in so many different ways.
Well, and then my
That's
question.
That's how we do it.
Well, then my question would be, how can we serve the Langston Task Force?
Okay.
How can we serve Girls on the Run?
Exactly.
How do we serve one another?
Yeah.
But then you got to know who you're serving and who can do what.
Yeah.
So this can grow, and I hope it grows into a movement. I think it will. I see all the intelligence and the passion in this room. I think it will. So some follow-ups, and then we're only 14 minutes late, which is pretty good. And then I'll get y'all out of here. So the follow-ups are, we're going to hammer on our side to make the organization official, Facebook, website. We'll get some pieces moving. And you guys are praying about, what do we do tomorrow on Tuesday? What am I doing on Tuesday to impact your own health, because that's important, and your family, your friends, your community? And as soon as you have that thought of like, I can't do anything, catch it. Take every thought captive. Just take it and say, that's not true. I have a lot of power. I can do a lot of things, because that's what's actually true. And so then we'll get that ball rolling. And so we should probably meet like this again every month, every 6 weeks, every 8 weeks, just to keep everyone in the loop. What's going on? What's changing? What's coming up? So that's my thought. And I'm pretty confident God will show us what to do along the journey. Because like whenever I see a patient, my thought is, how can I journey with this person to get where they want to go? And if they don't know where they want to go, which is pretty common, then how do I help them figure out, where is it you want to go? Then we're successful. Instead of me just telling them like, Adam, you better do this. No, that doesn't work. He feels fussed at. So instead, we journey together. And he's doing great. So I love you guys. This is a fun room. We'll break. Sorry to run you over just a little bit late. We did film tonight, so it'll be on the Facebook group whenever it gets ready. But I think we just need the community to make it work. And so start praying about, thinking about, where do I fit into this? Which of those little 7 categories is like my people, right? Schools, churches, clubs, nonprofits, businesses, politics. Where's my people? And then we start communicating together. So I really appreciate you. The last 2 things I need you to do is scan the QR code, and I cannot take all this food home. So if you will get some to-go boxes that Dave put over there next to the drinks, please take some food home and don't be bashful.
Is there some way we can donate some money to cover your costs?
We're happy to sacrifice it, but we can't do it all the time. So I think us making the nonprofit or some entity, then we can continue to do it in the future. But no, God,
Do you have a date set or,
for the next meeting
for the big one
in October.
whenever the blues, like what you did last year at Vision Board?
Oh, we're hoping January again. January would be a year. Yeah, and we had people from West Tennessee at that too. So that was a whole state. I know. Well, that was our first one. But I really do value each of you, and I'm really glad that you guys made it tonight. And I know that we're going to be successful. We just have to kind of hang on to each other, and we'll do fine. But I hope you guys have a great night. I'll throw on some music. Hang out as long as you want. Please get the QR code, and please take some food. Thank you, guys.